general, when the baby's heart beats, that helps to pump the fluid forward. When the baby's heart relaxes, the ventricular flow should still always go forward. Emily, the tech, thought she was seeing sometimes where there were pauses in the blood flow. We're not really seeing that when we look right now. And we think it was just kind of an artifact of ultrasound that she was actually seeing rather than something that represents a change.
You have not gotten steroids for these kiddos, have you?
Mm-mm.
A bunch of different places. Looks good.
And RMC is the closest hospital to you guys, right? Dr. Patel is there? Okay.
I was gonna ask, I know his kidneys still look big, so like what do we, are we just riding it out? And so say we deliver and they're still, like what do we?
So they will check after birth, like with an ultrasound to see if it's still dilated. Sometimes they'll start baby on like an antibiotic just to prevent any urinary tract infections, and then bring you to clinic in, a few weeks. Now, of course, these babies may still be in the hospital depending on when they deliver, but sometimes they do a scan to kind of figure out exactly why there's that extra urine. With this level, it's pretty uncommon that they need a procedure or something to correct it. It's something they just kind of follow throughout the baby's early childhood life, and often it just resolves entirely on its own.
Now, I think it was C. Hers was big at 1.2, but hers is still resolved, right?
We'll double check now, but.
She's not been super cooperative with us, but.
She never is.
Show us the other one.
We're running out of room in there.
You telling me? Is all their fluids still good today?
Yeah, B's was a little bit on the high
side
today, but that's
tell.
been
I told
true.
you, I was like,
You don't even need us anymore.
I was like, that looks like
Would you
it's
like a
kinda-
job?
Nope, girl.
The thing is like some of it could just be positional. Like there's not a, I think overall we just see that extra fluid in the kidney of A, that extra fluid around B today, and then C, we see that elevated Doppler.
Okay.
I do think that, you're getting close to the end of the pregnancy. What I would like to do is with these elevated Dopplers give you some steroids, okay? Because we just don't know what's going to happen.
Won't I have to be admitted for that with my
I don't
diabetes?
think so. We're on a pump, aren't you?
Top one.
Because they told me,
Yeah, okay.
Dr. Collier mentioned it one time and said that if we, once we got to that I would have to be admitted for that.
What was your sugar control?
I mean, my last A1C was 5.7, the one before that was 5.1. I mean,
My original thought was to give you a dose here and then let Dr. Patel do it there, but we don't admit all of our patients for steroids with type 1 diabetes this early, but like we're not, like we do it for like their ALP steroids, we don't necessarily, we just usually increase their sugars. I guess the thing is we can see, do you want to defer it? Like we typically would give, steroids for elevated Dopplers like they are now with your third trimester.
It's going to help them.
Uh-huh.
I want to do what they need.
I think we should. And, the thing is like, if you're like, today I don't want to do it, but I'll do it like Thursday, that's also fine too. Like, do you have a preference? Like, I do think it's better for us to watch your sugars while you're here for a day or so. And if you do well, then we can send you home. But what do you think?
is it something that could be done, like, where I come in on Friday and do the weekend so my husband can come with me?
Like get steroids over the course of the weekend?
Are you saying, I'm
So
sorry.
usually,
I'm confused.
when we give steroids, it's 2 shots.
Mhm.
So like, let's say you were like, oh, I want them today. We would give you a dose today and then a dose tomorrow. So exactly 24 hours after the first dose. And then, the effect of the steroids causing craziness to your sugars can last for like up to a week.
Right.
So I guess my question is like, because of the elevated Dopplers, and in the past they've been elevated, but they've also been some normal.
Right.
This time they're like mostly elevated. We typically do give patients
Right.
steroids.
No,
And
that,
so
that helps their lungs and stuff.
it
too,
does. It does. And if we give you a dose now, it doesn't mean we can't give you another dose before 34 weeks. So like, let's say, the dose, if we give them to you today, gives you a good utility for 2 weeks. But let's say at 32 and a half weeks, you go into preterm labor or something, we can give steroids again.
Gotcha.
Right? So we can give two courses.
Okay.
I think it's easier for us to watch your sugars in the hospital just because if we need to, we can slide anything. You're very well controlled, so I don't think you need to be there a whole lot of time, but it would be for both doses in the hospital.
So you're looking at like maybe an overnight stay?
Mm-hmm.
She could come on Friday.
Yeah, you can do it
that's
on
what I'm
Friday.
saying. Could we come in on, because if we could do that, my husband can
Come with you.
Because I think, like, I would, like, mentally, I don't.
Sure. You can even come Friday. You can even come Friday evening, like after work. Let me text the person who's on service now just to make sure that they're good with that. But let's see.
It's not gonna hurt the babies to wait till Friday. No, right? Okay.
Are all the babies' Dopplers elevated?
Just
baby.
Baby say she's the smallest.
Yeah.
If y'all
she's
had,
not too small. That's
She's
not the
still
thing.
growing
It's just,
and stuff, though. Right?
correct.
if
But
you-
she's not too small. She's just off the others.
Correct.
if you had to guess, how much would you think they weighed? Maybe the biggest ones and the little.
We'd have to look back.
Yeah.
So technically anything less than the 10th percentile is like abnormally small, and this baby has not been that.
Oh, good.
Yeah. It's just that the difference between this baby's growth and
Right.
these babies'
Correct.
growth is bigger than we
Right.
typically anticipate.
That's
It's
normal
not
though.
that surprising with triplets,
Right.
but it's
Okay.
not considered normal
Right,
either to have a
okay, yeah.
big separation like that. And so that's why we've been following the umbilical cord measurements, because it could be a
Measures.
sign that they're part of the placenta.
Right.
Yeah.
Good.
So when we looked at, like, the last time we did the growth was on the 28th, so less than 2 weeks, about 2 weeks ago. Baby A was at the 49th percentile, B was at the 51st percentile, so they were at average. But I want you to keep in mind, they're at average for a single
Right.
baby, right?
Right.
So they're big.
Yeah.
And then the third baby was at the 19th percentile, so all still very normal. There just is a difference.
Right. Between the three of them.
Yep. Let me see which.
Yeah, girl, I'll be reading all my notes. I get on my board, I'm like, let me read all this.
Well, she's worked
Well,
for
I've worked in the
OBGYN, so she's
so
familiar.
I'm not completely illiterate when it comes to. Now some stuff I'm like, what's that mean?
We do sometimes write in a foreign language.
Well, say she gets the first steroid shot, so if you'll be able to tell any reaction she might have as far as the diabetes.
Yeah, so that's why we would admit her is to follow her blood sugars.
Okay.
There are some people whose blood sugars are harder to control, who, like, we watch very closely on things like an insulin drip. There are some people whose sugars are not as hard to control, and they just need to increase their insulin that they're taking, and they do all fine.
Yeah.
Generally, it's about 5-ish days, maybe a little bit more, a little bit less after the kind of second steroid dose that you start to see things go back to where they were before.
Okay.
But at
It
least
does help that your sugars have been good.
at least at this admission last week, she got her iron infusion all at one time instead of.
Now I wish retrospectively we had done the steroids.
Right.
I know.
Yeah.
We just didn't know, did we?
So is there a chance that I don't know how this works, I've never had steroids since I've been diabetic. Like, is there a chance that I get these steroids and it throws me into labor?
Labor.
No, not labor.
Okay.
Cool. We were waiting for you to say something else, but you didn't. So it can cause you to have hyperglycemia. So like
Yeah,
for
yeah,
people who have poorly controlled diabetes, it can put them into DKA. That's what I was waiting for you to say.
Yeah.
But not labor.
Yeah, oh no, I knew that.
We've done that once, we don't want to do that anymore.
I'm trying to think if there's anything else.
I texted Ashley, waiting for her to text back. Just to make sure she's okay with the Friday admission for
And Friday can be her second. You're okay with that spacing for twice weekly testing? Or do you want her to come back before then?
Oh,
If I have to come back, it's fine.
I don't, for an elevated level, she's got twice weekly, she has to weekly.
I just wanna make sure.
Yeah, she can still come back next,
If y'all
Yeah,
do
but
this,
do we
if you
have-
do the steroid shot on Friday, it goes 2 weeks, right? So would we be seeing babies in 2 weeks, you think?
not unless something changed.
Oh, good,
Okay.
good.
This is just in
Like,
case
in
something
case
were to
something
happen in the
changed.
next few weeks with
Okay.
the Dopplers
Yeah.
or something like that. So let's say we give you these steroids and everything remains the same, we press on. But
That's what
if
those nurses were like, we might see that, and I'm like, no, girl, I'm fine.
It's like, take it back.
They would take my blood pressure one time. It was like 109 over 60. I was like, send my ass home. I'm fine.
And honestly, like I've had patients who've had like very well controlled diabetes and know how to deal with their pump. And I have like given them the ability to like mess with their own
Right,
pump with
right,
the sugars. Cause
right.
like you're able to do it immediately versus
Right.
like we have to wait and
Right.
put the stuff in. So like I am happy for you to do that. Like there are some
Okay.
people who can and some
Yeah.
people who
Yeah.
cannot do that.
Yeah.
So because of your kind of experience with your pump, I'm
Yeah.
totally okay with that. Okay, but let me give us a minute. I'm just making
That's fine.
sure that they're okay with that admission plan.
Okay.
And if they are, we'll just plan to get you Friday for the.
And I would just go back to
MU, just like.
the
Uh,
third floor.
The
right,
third
okay.
floor.
A
yeah.
shot that night and a shot the next morning.
No, they'll
Did you
do
say
a
it was
shot
2?
the same time, 2 days in a row.
So if you came in at like 3 p.m., you get the shot at 3 p.m. and 3 p.m. the next.
Oh, okay.
Yeah.
Gotcha.
And then they'll let her go home.
Depends on how your
Sunday or
sugars
Monday
look,
after
but if
the
all
shot.
looks good, they can let you go home. And then you'll see me next Monday. It looks like it's
Yeah,
already scheduled
yeah,
for you.
already have my
And
We
so-
need to get you back into MFM clinic too.
Yeah.
What about
I'm